What's going on, everyone? Welcome back to my channel. In today's video, we're going to talk about exercises for acute low back pain. I get this question quite a bit when I have a patient who asks me, I just hurt my back and it's really flared up. There's hardly anything they can do that doesn't cause pain. So we're going to look at 3 of the best movements you can start with just to kind of start moving, but also not too stressful to flare your pain up. So if you've got an acute back pain episode, maybe in the first 2 weeks of that issue, these are going to be exercises you'll want to check out. So when starting out, like I said, we're going to look at movements that just kind of barely start moving the low back. They don't add a whole lot of stress because, as you know, if you've ever had back pain, any bit of increase in stress can really increase pain. But we don't want to be totally sedentary and not move at all. We want to start moving. We know movement can really influence pain and the healing of injuries. So this first exercise, you're just going to lay on your back. This is called a single knee to chest exercise, and it basically helps to stretch the hip joint. We have quite a bit of research showing that mobilizing the hip joints can help the low back. They're adjacent joint regions, so it makes sense from a kinetic chain standpoint that if we work our hips, it can help our back. So in this one, all you're going to do is bring one knee up and kind of use your hands and just pull that knee towards your chest as far as you feel comfortable. Doing this will move the hip into flexion. When the hip moves into flexion, it moves the low back into flexion just a little bit. So just take this as far as you feel comfortable. Just take a few deep breaths and kind of hold here, and then put that leg down and bring the other one up. And you're just going to go back and forth from side to side, maybe 3 to 5 times on each hip, whatever. You really have to pay attention to your symptoms and base it on how you feel. Everybody's going to vary a little bit. So you're just going back and forth like that, just working on kind of stretching the hip joint, the glutes, some of the hip rotators, and again, just imparting a little bit of movement in the low back and helping it calm down. Okay, so this is one you can do every day. All the movements in this video you can really do every day to start reducing pain. For the second exercise, we're going to more directly move the low back. These are called pelvic tilts. What you're going to do is take your hands in sort of a C shape and put them on your fingers will touch the front side of your pelvis and your thumbs will wrap around to the back. That'll just help give you a little palpatory tactile cue of where your pelvis is at in space. And then what you're going to do is basically go into anterior pelvic tilt, which will cause your low back to arch, and posterior pelvic tilt, which causes your low back to flatten. So we're essentially going from low back or lumbar extension to low back / lumbar flexion. So again, just going back and forth, we know movement is a really powerful modulator of pain. Doing this type of pelvic tilt might seem kind of silly and simple, but it can help to move nutrients and increase blood flow to the tissues of your low back, your spinal discs, the ligaments, tendons, muscles in the area, and the facet joints, all of which can be pain generators in the low back. So you're just going to go back and forth. With this one, I'll typically have people do 10 to 20 repetitions. Again, just move as far as you can. Stay in a comfortable range. Don't increase pain. And this can be done 4 to 5 times throughout the day just to help improve blood flow to the area and get nutrients in there and get inflammation out so that ultimately your pain gets better and you get moving forward in terms of the healing process. The last and final exercise is going to be more of a hip muscle sort of activation, not really strength, but just more movement activation of the glutes and hip rotators. Again, we have a lot of research showing that working the hip can help with low back pain, and it's a great place to start because you're not stressing your low back. So if you've got a really sensitive low back, sometimes hip exercises are the best things to do. So this is one a lot of people are familiar with. It's called the clamshell. You're going to do both legs. I'm just going to show one here, but you're going to lay down. You're going to have your legs stacked like this, and then your hand's going to go up here on your pelvis, and you're just going to lift your knee up as far as you can. My hip is rotating here. You're going to lift as far as you can without rotating your back, okay? So it's just meant to be a hip movement. Just go up as high as you can without moving your spine. And often this is done with a band around the knees when we're focusing on strengthening, but because this is more of a pain
alleviation, pain management video, just start with leg weight. It's still going to work the muscles and it's going to get things moving, and again, kind of help clear inflammation and get rid of pain. So with this one, I would shoot for 10 repetitions and then switch to the other side and do that 4 or 5 times throughout the day to help ease pain.
Okay guys, those are the 3 movements that I have a lot of patients start with who really have a flared up low back. That pain is so acute that you can't do much. These are good ones to start with. They don't put a lot of stress in terms of force on the low back tissues, so they're a good place to start. The other thing to mention too is that just walking. Walking has quite a bit of research for low back pain, so just try to go for, maybe a 5-minute walk, a 10-minute walk, a 20-minute walk. Just try to go every day. Walking is a great way to sort of rhythmically bring nutrients and blood flow into the low back. Okay, guys, I hope this is helpful. Please leave any questions you have in the comments and I'll try to get back to you. All right, see you next time. Bye.